What's up? Happy Wednesday. We have a great topic for tonight. We are going to be talking about shoulder pain, which I've heard from a lot of people in the group and a lot of people, just clients in general, dealing with a lot of shoulder and hip pain. Tonight, we're addressing shoulder pain and how to still overhead press without causing increased discomfort or making your shoulder pain worse, right? So there are still ways you can press overhead without increasing your shoulder pain that are safe for your shoulder joint that can still help strengthen you and put you in a better position overall. Okay, so there are 5 things we're going to talk about tonight. We're going to start with number 1, right? So the first thing you want to do if you're dealing with shoulder pain, right? Typically it's in the front, especially if you have impingement. Could be on the side, could be the top, right? Could be even up here. An issue at the shoulder could refer pain up here or even down the arm a little bit too. Just depends, and you only know when you go to get kind of accurately assessed through your medical doctor, right? Orthopedic doctor typically, or their physician's assistant, or physical therapist / chiropractor. Okay, so number 1 is partial range or depth, right? So the big thing with this one is if you're having a lot of pain with overhead pressing, shorten the range a little bit, okay? So instead of pressing maybe you have pain just here at the top of the range, right? So maybe you stop here, right? Work in that plane. You can even slow down the tempo a bit. We're gonna talk about that one a little bit more in detail. But partial range or depth will really, really help kind of keep your shoulder pain free, but still help strengthen some of those other muscles. And you can increase the weight, right? Because you're shortening the range of motion, you can use more weight, which is safe. You can add a band too, apply different kind of rounds as resistance, which is another thing we're going to talk about. I'm giving away too many here. So other thing with partial range or depth is like you want to keep your shoulders in the scapular plane. What does that mean? The scapular plane just means that your arms are going to be a little bit kind of forward and a little bit out to the side. So the scapular plane looks like this, right? If I'm pressing, it's kind of like right here. So this is a side view. If I turn this way, you can kind of see it's kind of right here as I'm pressing. Right, scapular plane is not directly out to the side, right? This is a normal overhead press, right? This is kind of you directly pressing up and down, right? Which is the frontal plane, right? If you were to draw kind of a line from here to the ceiling, this would be frontal plane. If you have shoulder pain, you want to just bring those elbows in a little bit, and that's going to help take some strain and stress kind of off of the shoulder blade, especially your rotator cuff tendon, right? And your bicep tendon, the long head here. If you can do that and move it out here, that's going to help a lot. It's a game changer for a lot of people. Anyone who has shoulder surgery, like rotator cuff repair, labral repair, etc., that will typically do that when they're just getting reintroduced to overhead pressing. Because usually if they come out here, it just puts a lot of strain and stress on the anterior deltoid, the pectoral muscles, and that whole area bunched up. Okay, so that's number 1, partial range or depth. Keep shoulders in that scapular plane as you do it. Again, you can use a band, right? You can use a band around both wrists, do it that way. You can step on a band and hold it, do it that way, or you can also use dumbbells, right? Either or barbell, right? Whatever you're into. Number 2 is super slow tempo. I just touched on that a little bit. Slow down your tempo. The slower your tempo is, the more you're going to keep tension on the muscles and the more you're going to properly work the muscles. So slow eccentrics really help, especially if you're trying to kind of heal a tendon and give nutrients to it. Eccentrics work really well for tendonitis. So what is an eccentric? What is slow tempo? You could go up slow, right? And staying in that scapular plane, right? Staying out here, I got to correct myself, right? Pressing up and then down really slow, like 5 seconds. You can even come up quick and then come down slow, right? It's up to you. You can toy around with it. If you have pain moving quickly, then slow it down, right? You're going to have better form when you slow things down. And the other thing is use a mirror. I should have added this to the list, but use a mirror for biofeedback, right? Set your phone up on the side. I have my clients do this all the time. I'm like, send me a video. I need to see you doing it. And 9 times out of 10, they have pain with certain exercises or stretches because they're not doing it properly. And a lot of them work out at CrossFit boxes and they just don't have access to mirrors all the time, which is fine. Like you don't always need it, but it's nice to have someone looking over you or nice to have you self kind of assessing yourself while you're doing these things. So, get a side view, get a front view, make sure you're in that scapular plane, make sure you're slowing down the tempo, make sure you're not overarching your back, moving your head around, you don't have your head poking in and out. Right? Unless you're like Olympic lifting, it's a little bit different, but we're talking about for pressing without shoulder pain. All right, so that's number 2, super slow tempo. Slow it down a little bit. 3 to 5 seconds is a great tempo on the eccentric on the way down. And again, you don't have to just decrease your range up here, like we said for number 1, partial range or depth. You can stop your depth here too, right? So you can stay in this plane and still work your shoulders rather than coming all the way down. Because people usually have pain at the bottom of a shoulder press and at the top. Sometimes when they cross that shoulder height too. So you can always stay in this range and work it as well and do some isometric holds too. That's another one I should have added. I can add a bunch of these, but we're only gonna talk about 5 because it can get super overwhelming. Number 3 is perform sitting with back support, right? So say you're using a lot of weight or you're just not performing it properly. Like I said, you're arching your back a lot to get that weight up. You know, you feel your back, you feel in the front of your shoulders. Maybe you have really tight pec muscles, or you have limited thoracic spine mobility. You know, pick a chair, or excuse me, pick a bench to sit in. You can even do a chair if you want to. You can put a foam roller behind you. That works really well. And then you can kind of lean against it a little bit. You don't want to lean like this, just a small lean, right? Keep your abs locked down and then work in that scapular plane doing it that way. Right? It's another kind of great alternative way you can work on strengthening your shoulders and your rotator cuff and pressing without any pain. And a lot of times it's easier for people if they do lean back against something because it helps open up that shoulder a little bit more. All right. Sometimes it's even helpful too if people don't do a normal grip like this, right? They tend to turn their hands outwards a little bit. So more of a neutral grip, neutral just meaning palms facing each other like this, right? If I'm holding a dumbbell, I'm like this. This usually helps open up the shoulder a little bit more and create more space. Or even if you externally rotate a little bit. So if you turn your thumbs outwards, right? Sometimes if you turn out too much, it's too discomforting. So I usually tell people stay in that scapular plane and stay with that kind of nice neutral grip with the dumbbells kind of facing each other. All right, so that's something you can toy around with. That's number 3, performing sitting with back support. Number 4 is decrease the weight, right? Simplest one, decreasing the weight. Sometimes you got to leave your ego at the door, especially when you're rehabbing or recovering. Don't just jam kind of the weight up and kind of get more and more pain and take 3 to 4 days to recover. That's not right. Soreness should last 2 to 3 days at most. Then you should be able to recover on that 4th day. If you're not able to, you're probably overdoing it, or something's off with your form, or something's going on, internally, anatomically in your joint or physiologically, right? So you really need to kind of just hone in on that and really focus on improving that. And don't work. Pain is okay at some points, but if you have pain every time you do shoulders, that's a red flag, right? That's something you need to get looked at, or something you need to kind of get assessed. Other thing is, like I mentioned this like a couple minutes ago, is use different profiles of resistance. And what do I mean exactly by profiles of resistance? All I mean is you can use a band, right? A band's going to give you constant tension throughout the full range of motion. So say I'm stepping on a long band, holding it in both hands and overhead pressing, I'm going to have tension from the bottom of the rep all the way up to the top. And it's going to be hardest at the top when that band is fully kind of stretched, right? That full elastic kind of type of resistance. So that's a kind of one type of resistance profile. I can use dumbbells, which is the second type, right? And a dumbbell is going to be really hardest at the bottom of the range, right? It's going to be easier kind of up here. It's going to be hard at the bottom in that midpoint range. Once you get over that, it gets a little bit easier to get through. So that's a little bit harder, right? The initiation, if you want to work kind of down here, I would use a dumbbell. If you want to work up top, right, I would use a band. And it's good to use both, right? Why not use both and hit different muscle groups and target different profiles of resistance? You can use a kettlebell too. Upside down kettlebells are really good for shoulder stability. If I'm holding a kettle upside down by the horns, I really have to balance that stability with my shoulder. So you might find yourself going in and out a little bit. Bamboo bars work really well. The kettlebell and bamboo bars are a little bit advanced. I would start with the dumbbells and the bands first, then you can progress to those things. Okay, so that's number 4, decrease the weight. And then number 5, the last one, right, as you guys are probably sick of hearing me talk, is use assistance, right? What do I mean by use assistance? Have someone spot you, right? Say you're like struggling a little bit. They can give you a little bit of kind of feedback, like tell you about your form, tell you if you're staying in that scapular plane or leaving it. They can even help kind of push you kind of above those areas of where you have pain, or they can provide resistance to you to make it harder too. So using assistance really helps. The foam roller could be assistance too. If you're leaning backwards into a little bit when you're sitting, you can lean back against the wall when you're doing it. It's another way of kind of getting some type of assistance. You can use other body parts too, right? Instead of kind of pressing directly upwards, you can kind of scoop it forward like this and then press upwards. And that's going to pull some biceps into it, some lats, and it's also going to pull in some serratus anterior muscle, right? So there's so many different things you can do. And if I was talking for like 3 hours, we can go over probably 30 of them or more, but we're going to keep it to 5 to keep it simple. So just to recap, right, how to perform overhead pressing while dealing with shoulder pain, is 1, partial range or depth. You want to keep those shoulders in that scapular plane. Again, not directly up here, a little bit inwards and a little bit down, right? Number 2, super slow tempo. Right, number 1, also partial range or depth, right? Again, staying kind of low or staying in this range of motion. Number 2 was super slow tempo, so slowing it down. Really slow eccentrics tend to work really well to build up strength. You can do isometrics at that mid-range portion or the bottom to mid-range. It's another way to safely strengthen. Number 3 is performing sitting with back support. So again, foam roller behind you or leaning back against the bench. Number 4, decrease the weight. Use different profiles of resistance: bands, dumbbells, kettlebells, bamboo bar, barbells, etc. And number 5 is using assistance, right? Using friend, you can even use bands, guys. This is one I should have mentioned, but I do this a lot in the gym. If I'm fatiguing and I'm on that like 3rd or 4th set and I'm doing 5 or 6 sets, instead of like failing and giving up, I'll attach 2 bands to a rig or a pull-up bar above me, and then I'll attach them to the bar or attach them to the dumbbells. A little harder with dumbbells, you need assistance for that, but I would say a barbell works best. Like, use a barbell with light weight, put 2 bands around each end, right in the middle area, and have that band attached to the pull-up bar above you. And while you're pressing, that band's going to help pull that bar upwards. That's a great way you can kind of still overhead press with kind of putting excessive strain or stress on there. All right. And you don't have to overhead press, right? There's other ways to strengthen those muscles and get strong there and get better at overhead press without actually doing it. But this is the topic of tonight. And I know people, from clients I've worked with and people, I've just spoken to in the Facebook group, they love to overhead press. So that's why I wanted to make this topic and make this video for tonight. So if you have any questions, please feel free to link them below. If you have already and I haven't seen them, I apologize, and I will look at them right after this. And thank you so much for tuning in, and we will see you on the next one.